Hello everyone. So today I'll be talking about herbal medication that you must know before giving entrance examination. At first you need to know about the general consideration while taking or while patient is on herbal medication. So at first you need to know about uh, whether the patient is taking any kinds of herbal medication or not. If they are taking any kinds of herbal medication, then you must inquire about amount of herbal medication and how they are using it. Similarly, you must determine if it cause any harmful interaction when combined with any other drugs. Similarly, you should also know about the potential interaction and necessary response. For example, delay surgery, change in medication, or dosing. There are certain herbal medications that must be stopped 2 to 3 weeks before any kind of surgery due to risks of anticoagulation property. So you must know the potential interaction. Similarly, contact to a pharmacist in order to determine more possible interaction with other drugs. So these are the few general consideration you must know if patient is under herbal medication. Let's go towards the different kinds of herbal supplements. So at first we are going to learn about black cohosh. It is indicated in order to treat the menopausal symptoms like hot flashes. It is also used to lower the blood pressure. It has side effects like it causes the thickening of uterine lining and may cause liver injury. It interacts when given with hormonal therapy and cardiac drugs. Therefore, this black cohosh is contraindicated in case of chronic heart failure and pregnant women. Similarly, St. John wort. This is most commonly asked during your entrance examination. It is indicated to treat mild to moderate depression. It also acts as an immune stimulation. So it has various side effects like dry mouth, it causes dizziness, hypertension, and photosensitivity. It interacts with different kinds of drugs like SSRI, SNRI, MAOIS, TCA, especially psychotic drugs. Because it causes serotonin syndrome. Similarly, it also interferes with theophylline, immunosuppressant, tetracycline, desoxing, oral contraceptive pills, and warfarin. It is contraindicated among hypertensive and immunosuppressant patients. Uh, So now let's go on this saw palmetto. It is most commonly asked during NCLEX examination and it is especially indicated in case of BPS in order to improve the urine outflow, healthy testosterone, and anti-inflammatory properties. Its side effects are it can cause mild nausea, headache, GI upset, and hypertension. Interaction regarding saw palmetto, it is known to be very safe herbal medication as till date there is no any known interaction uh, no known interaction while using these drugs. It is considered safe, so it has no any contraindication. Similarly, another kind of herbal medication is garlic. Garlic it acts as a natural antimicrobial properties, so it is indicated to lower cholesterol, to increase HDL, reduce blood pressure. It also acts as an anticoagulant, in, and also it is used in case of anxiety to provide sedation. Similarly, it has various kinds of side effects, especially it causes hypoglycemia, it lowers the blood pressure, it can upset our GI system. Similarly, it can cause heartburn and sedation, and also it leads to excessive thinning of blood. So it interacts with especially drugs like anticoagulants, aspirin, antihypertensives, and NSAIDs. So garlic is contraindicated in case of patients who have breathing disorders. And our next commonly used herbal medication is which is also known as ginger. It is indicated to cause analgesic effect. It acts as a digestive aid. It relieves nausea, motion sickness, and also it acts as an antioxidant in order to relieve fever and congestion. It has side effects like it gives anticoagulant effect and it can cause heartburn. So it interacts with drugs like hypoglycemic drugs as it decreases its effect, and also it increases the anticoagulant effects. Therefore, we should take this ginger cautiously in case of cardiac and hypertensive drugs. That means if the patient is under hypertensive drugs and is cardiac patient, ginger must be given with caution. The next herbal medication, which is also known as ginkgo biloba. Its indications are it acts as an CNS stimulant, antiplatelet, and antioxidant agent. It improves attention and memory, and also it delays progression of Alzheimer's disease. It has major side effects like it causes GI upset, headache, indigestion, nervousness, palpitation, and may cause allergic reaction. It also affects our body. So it provides the effect like anticoagulant effect, and therefore it interacts with drug like anticoagulant drugs, and it decreases anticonvulsant effect. Also, ginkgo biloba it acts as an diuretics. Similarly, ginseng is most commonly used in country like China, Korea. So you must know it is indicated in order to improve the mental alertness. It enhances immune system. It helps to boost energy. It also prevents aging. It improves diabetes symptoms. Along with it raises the good cholesterol level. It improves the stamina and sexual performances. It has some side effects like it causes insomnia. It increases our blood pressure. There may be risks of bleeding, hypoglycemia, allergic reaction, and diarrhea. It interacts with drugs like digoxin, alcohol, anticoagulants, MAOIs, insulin, and antidepressant. So, ginseng is contraindicated among the patients who are pregnant, hypertensive, who have bleeding disorder, asthma, and among the young children. And another kind of herbal medication is also known as licorice root. It is indicated to heal gastric ulcer. It acts as an diuretic effect, steroid withdrawal. We can use this. Similarly, it has side effects like it causes hypertension, headache, lethargy, and cardiac dysfunction. It interacts with different kinds of drugs like steroids, oral contraceptive pills, antibiotics, NSAIDs, and digoxin. Licorice rice root is contraindicated among the patients who are pregnant, hypertensive, who are lactating, who have glaucoma and stroke, as it interacts, and it may cause effects like cardiac dysfunctions and many more. Similarly, melatonin, it is indicated in order to prevent the jet lag while traveling and fatigue from traveling. It provides energy and alertness, so it is used. It has side effect like we cannot use high dose because it causes the vivid dreams and nightmares. So it is instructed to use low dose for a short period of time only. And melatonin is used prior to or during the air travel, especially. Valerian, this is also another herbal medication. You need to know that it is indicated in order to quiet and calm our neurological symptoms and systems. Similarly, it promotes sleep, it reduces anxiety, nervousness, and headache. It has side effects like it may cause headache, restlessness, nausea, and blurred vision. It interacts when it is consumed with alcohol or any kind of other drugs like barbiturates, sleeping tablets, benzodiazepine. While valerian is used with benzodiazepine and other drugs, you must use cautiously because it may cause various side effects. This valerian is contraindicated in the children below 2 years. Evening primrose, which is used especially in order to treat ischemia. and skin irritation. It may cause seizure and have anticoagulant effect as in side effect. Another herbal medication, which is also known as kava root, it is indicated to treat anxiety and insomnia. It has side effect, so it may cause severe liver damage. So you must be cautious while giving this, and you must know whether the patient is under this herbal therapy in order to prevent further damage among the patient. So our next supplement, which is herbal supplement known as Echinacea. It is indicated especially in order to prevent and treat common cold. It stimulates immune system and it promotes wound healing. It has a rare side effect, fever and nausea. It also can cause anaphylaxis in case of susceptible individual. It interacts by reducing the effect of immunosuppressant. It increases the serum level of alprazolam, calcium channel blockers, and protease inhibitor. So while giving this, while patient is on this herbal supplement, you must consider that long-term use may cause immunosuppression among the patient. This was for today. Uh, Here I have included one question regarding your entrance examination, which they may ask during your exam. A 50-year-old patient with hypertension is interested in starting an herbal supplement to help manage their blood pressure. The patient reports taking prescribed antihypertensive medication. Which of the following herbal supplements should the nurse caution the patient about due to potential for interaction with their current medication? So in this question, it is asked that the patient is taking antihypertensive medication and is planning to start herbal medication in order to manage the blood pressure. So, which medication should the among these, which of the medication would have potential interaction while taking with antihypertensive medication? Echinacea, ginseng, Saint John wort, or garlic? So the correct answer is garlic, because garlic has a blood thinning properties. So it may affect the antihypertensive medication, which may lead to increase in risk of bleeding or hypertension. So, the nurses must advise patients to consult their healthcare provider before starting any kinds of herbal medications, especially when they are on prescribed medication. So, thank you so much. Do not forget to like and subscribe my page and stay updated for more videos.